Honourable Member for Medicine Hat, Cardston Warner.
Thank you, Madam Speaker. On February the 16th of this year, I requested the government provide the data used to support their public policy decisions regarding their failed pandemic response and their plan for recovery. This data is either being intentionally hidden or not available because they failed to collect it. No one expected perfection in this kind of situation, but we all expected better. This lack of data might explain the government's erratic and incoherent response to this pandemic. They are failing on everything from travel screening and rapid testing to vaccine procurement, vaccine rollout, and lockdowns, all of which continue to plague our country's ability to recover. Strangely, Canada was not even ready for the pandemic. Besides missing information and outdated IT systems, our strategic stockpiles of PPE and other supplies have been destroyed or given away, and our global public health intelligence unit's early warning system had been disabled. So many are asking, was better possible? Well, yes, it was, and it is. Experts have told us that Canada did have emergency pandemic plans at the ready. In fact, Canada, along with the World Health Organization, had laid out recommendations from clear lessons learned from SARS. Canada even created the Public Health Agency in response to SARS. So it seems impossible to fathom that the organization specifically created to respond to a SARS crisis had no planning or preparation for a SARS-like crisis. So where is that previously developed plan? Canadians understand that not every decision is perfect, but they deserve to know what the plan was and why it changed. What information was used to make the decision to deviate from those emergency plans? Plans are essential, Madam Speaker, not only for providing a step-by-step process, but to provide reassurance, allow for proper allocation of resources, and empower people to be part of the solution. To be clear, stay at home is not a plan. Daily infection rates and death counts are not a plan. All emergency management pandemic plans have four basic and clear goals. Number one, control the spread to reduce illness and death. Number two, minimize societal disruptions. Number three, minimize economic impacts. And number four, support efficient use of resources. This government has failed Canadians on all four of these goals. Canada acted slowly to limit the spread and has failed repeatedly to minimize it, and still no plan. Liberal failures have created societal disruptions that are unprecedented. Jobs, livelihoods, businesses, homes, families, and lives have all been lost or destroyed. These losses cannot be easily replaced by government checks and empty platitudes, and still no plan. Canada's economic impacts are huge and are much worse than many peer countries as our economy is teetering as a result of Liberal failures. Canada has massive job losses, high unemployment, and the highest per capita spending during this crisis, yet with little or nothing to show for it, and still no plan. The Liberals have also failed Canadians on the effective use of resources, as we have lacked access consistently, and vaccines are an example, and still no plan. All these impacts will last for generations. The mental health impacts, business losses, and job losses will have long-term consequences. Canadians are rightfully questioning the Ministers of Health and her government's decisions and are realizing that that government, the Liberal government, has no clear plan for recovery. So, Madam Speaker, the question to the Minister is, where is the data used to support their public policy decisions, and what is the plan for recovery? Thank you.
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker, and thank you for the question. I think it's pretty sad in this country when partisanship in a pandemic takes over the clear public health measures that have been taken from day one. The fact that the members opposite really have nothing of substance to talk about themselves or ideas where they could actually help Canadians get through this pandemic. They make up things that simply are untrue. Madam Speaker, from day one, our government has been in action to work with all Canadians, provincial, territorial governments in dealing with this pandemic, whether that was early on in acquiring PPE, rapid tests, and then throughout the procurement of vaccinations that are now rolling out. Madam Speaker, the Conservatives continue to raise this issue that there is no plan when in fact the plan has been outlined from the beginning. It's just the Conservatives can't stand the fact that we are moving ahead during this pandemic, and they seem to not be able to grasp the plan because they don't have the basic understanding and support of science. Throughout science and evidence and data, that when it is collected and with this virus, as new things are learned, that requires a relook at the examination of the data and to adjust accordingly. Something we have done every step of the way based on the evidence and advice of public health officials. I want to remind you, Madam Speaker, it was the Conservatives that just a few weeks ago were saying Canadians, that provincial territorial governments ignore your public health officials and just open up. And now we are seeing a third wave. And in my home province of Ontario, we're seeing places like Sick Kids Hospital preparing for COVID patients because we're running out of room with ICU beds. And the federal government has been there to help support provinces in the delivery of healthcare. But, Madam Speaker, if the Conservatives had their way, they would just pretend the virus didn't exist and see more and more Canadians die. It is, if the member opposite would like data on an epidemiological reports, he needs to look no further than the Public Health Agency of Canada's website. There has been enormous amounts of data and tests performed, positivity rates, rates of intensive care usage, and so forth, which are all part of the larger plan and reaction and support from the federal government. If the member opposite would like data around decisions around lockdowns, as he well knows, those are decisions that are done at the provincial and territorial level. However, we continue to support what provincial and territorial leaders need to keep their citizens safe. But in terms of data, there have also been thousands of pages produced to various committees, as well as sitting sessions and members of the government, ministers being available to answer questions. So, Madam Speaker, just to conclude in this point, that the data exists and is readily available. The Conservatives just need to look at it and understand science and the evolution of this data and the outcomes that come from it.
The honourable member for Medicine Hat, Cardston Warner.
Thank you, Madam Speaker, and I'd like to congratulate my friend on her recent appointment as the Permanent Secretary to Health. Good for her. The reason that Canadians and not only Conservatives can't grasp the plan is because there really isn't one. I mean, Madam Speaker, the fact remains that this government seems incapable of being honest and clear with Canadians. They appear unable to deliver a plan or even targeted guidelines for when Canadians can expect things to return to some semblance of normal. Canada's failed pandemic response was perhaps all the Liberals could manage, but it is not what Canadians needed or expected. By ignoring emergency management pandemic plans and following failed lockdown responses, the many Liberal failures have caused massive collateral damage in terms of deaths and long-term effects on our population. Collateral damage largely ignored by the mainstream media. This government's lack of leadership has undermined the trust Canadians require in times of crisis. This government needs to be honest with Canadians about what the pandemic plans were before the pandemic, why those plans were abandoned, and what information is still missing in order to make appropriate recovery decisions moving forward. Thank you, Madam Speaker.
The Honourable Parliamentary Secretary.
Thank you, Madam Speaker, and thank you to my honourable colleague. That's just it, Madam Speaker, that the government has relied on the best available science and data, and you can't just transmit one plan to the next. We have to be able to adjust based on, in this case, the virus, to make sure that the plan, the process that we're moving forward is actually the most relevant to the pandemic that we're dealing with. And that's why relying on the best science, the best data, listening to experts is the best approach for Canadians. And as a result, we've actually seen, we've seen jurisdictions be able to adjust accordingly. And Madam Speaker, we're always going to to rely on evidence and science and the innovation and techniques of data collection that is going to help get us out of this pandemic.